Hi everybody, my name is Jasmine Alajic. I'm an accounts manager at UK-based Erconia Lasers Limited, subsidiary organization for Erconia Corporation, looking after their interests in Europe, Middle East and Africa. Thank you for joining our webinar tonight with Dr. Eric Rees on why inflammation is the silent killer and low-level laser is your best kept secret weapon against it. This webinar will discuss the multifaceted integration points where non-thermal low-level laser can treat underlying inflammation and inflammatory-based conditions, aiming to educate providers on best practices and use cases for immediate implementation into their practice. For those of you who don't know Dr. Eric Rees is a doctor of chiropractic medicine and board-certified chiropractic neurologist at the Neural Connection in Minneapolis, USA. He received his doctorate in chiropractic medicine from Northwestern Health Sciences University, graduated with magna cum laude and honors, and graduated from the University of Minnesota with his Bachelor of Science degree in kinesiology, exercise science. Dr. Rees is also a certified brain injury specialist through the American Brain Injury Alliance and has been a clinical educator with Erconia for the past 2 years after working extensively with their world-class technologies for nearly a decade. Dr. Eric Rees is also the co-founder and director of Health and Wellness at Nobody Studios, a rebel venture studio focused on the radical ideation, innovation and creation of people-first startup companies. Okay, we will be happy to assist you further at the end of the webinar, which for your reference will be recorded and sent out to all the attendees. I would like to alert you to the question and answer box on the right-hand side of the screen, which you can use to type in your questions to Dr. Rees. We will be addressing these questions at the end, but please type them in as we go along. Okay, I will pass over to you, Dr. Rees.
Thanks, Jasmina. I have to say, on the record, I think that's the best anyone's ever read my bio. So there you go. You can hang that over Simon and everyone else's heads. So yeah, awesome. I'm just gonna exit out of this video box that I see. Jasmina, can you just confirm for me that you can still see my slides?
Okay, I can see a slide here. Yeah, if you could scroll down.
Did you see the slide change as well too? Everything's good?
Yes, everything is good. I hope everybody else can see. If somebody has any questions, they can just type in for me so we can go ahead with that.
Brilliant. Okay, awesome. Well, I would first like to thank everybody for joining us today. This is a topic that I am super passionate about. And I think it's a topic that's very relevant for all of us living life in 2022. This is a hot discussion right now, and there's a lot of information coming out about inflammation, about what aging looks like, and I'm really focused on touching on a lot of these points and really showcasing how amazing the effects of low-level laser is in being able to combat a lot of this. I think that we thought we knew a lot about the brain and the body, and over the last 20 to 30 years, there's a lot that's actually changed. And so there might be some common myths that we dispel today as well. But what I really want to focus on is, more importantly, what you can do as a provider to help the patients who come into your office tomorrow. Because that's what this is all about. This is about helping people, and this is about taking the expertise and the knowledge that we have and implementing it and putting it into practice. So here's what our agenda looks like today. We'll kind of go through and talk about inflammation, inflammatory-based conditions. We'll talk about the underlying mechanisms of low-level laser, talk about its anti-inflammatory effects. We'll talk about just relevant research in the traumatic brain injury space, talking about aging, how this all kind of combines together, and how some of these models share a lot of commonalities. And then we'll talk about best practices. We'll talk about what you can do with your patients tomorrow, what you can do to start implementing a lot of this information right away. And one of the things that I always start my seminars off with is really asking people, why they're here. Like, what is your why? Because this is my why. I lost my grandfather to Alzheimer's and cancer in 2014. And that was a really hard thing for me to witness. I was living in a completely different part of the United States from where my family was. And I saw the really big changes and significant factors that would go into not seeing him for days, weeks, and sometimes even months. And so there are some really, really emotional memories that I have about that time. And so I knew at that moment that I would do anything to make sure that that doesn't happen to me and any of my loved ones. And so this has really just been the start of a long journey for me of figuring out how can I have the best brain for as long as possible? Because I've played contact sports most of my life. Yeah, I've played ice hockey and football, aka soccer for those who are from the States. Probably not many on this call, but I've hit my head many times. Fortunately, I've been in a situation where I've never had a game-ending or season-ending concussion, but I've definitely had my bell rung. And for me, understanding all these mechanisms and how inflammation plays a role and how this manifests structurally, neurologically, and even metabolically is something that I really am passionate about understanding, but more importantly too, I want to mitigate any of that stuff happening in my life because my family is my life. In that photo, you see my lovely wife and my beautiful dog, Dolly. And so this is why I do what I do is I want to be able to live a life worth living. I want to live a life of not having any regrets. I don't want any limitations, and I don't want to miss out on any opportunities, whether that's seeing my kids play sports or picking up my grandchildren or just being able to be neurologically capable enough to be able to take a vacation with my family. And so I think this is a really important component for us to ask, why are we in practice? Why are we helping patients? Why are we doing what we're doing? And then more importantly, how does this transfer to your personal life? I have a EVRL at home that I use every single day. Simon just sent me a brilliant stand that I can use now. I don't have to hold it over my head so often. And so I am passionate about laser because I know that it works. I've seen it clinically with patients, but I'm also pretty selfish because I use it on myself all the time. And so for those of you out there who have laser, how often are you using it on yourself? Are you a walking case study or testimonial? Those of you who don't have a laser, what's stopping you? What's stopping you from wanting to optimize your health? I hope I can, educate you far more about the capacity and the amazing technology that this possesses, especially with what Erconia brings to the table. But I think that understanding your why is a really important factor with this because there's a lot of information out there. And unfortunately, what we're finding out is that inflammation really is the cause of aging. And so this new term called inflammaging is really kind of becoming hot on the scene because it's all about understanding how inflammation plays a role with aging. And ground zero for any research coming out in the aging or inflammatory space is all about the mitochondria. Your mitochondria do so much for your brain and body that it's almost tough to really fathom. What's even more impressive is that your mitochondria don't share the same genetic makeup as we do. There is, I think it's like 1.5 billion years ago, the eukaryotic and prokaryotic cells came together, and that's how mitochondria actually formed a symbiotic relationship within our cells. Now, we're fortunate to have them, even though they have single-stranded DNA and we have double-stranded DNA, because we have this amazing relationship now where we're dependent on them for energy, cellular signaling, calcium and iron buffering, reactive oxygen species. I mean, steroid hormone and even heme biosynthesis, they play a super important role in a lot of these basic mechanisms that we take for granted. More importantly, too, they play a really important role in controlling our innate immune system. Okay? This is why inflammaging is really ground zero in the mitochondria, because we know that your mitochondria, when they're not doing well, can actually promote pro-inflammatory mediators to be produced. I'm specifically talking about C-reactive protein, interleukin 6, and fibrinogen. Now, what becomes relatively apparent relatively quickly is not only are these pro-inflammatory mediators, hallmark markers for different types of like clinical testing via blood work, but what's really impactful and empowering for this as well too is that these are areas that can be impacted with low-level laser, and we'll go through the research and talk about that. This relationship between these pro-inflammatory mediators actually exists in the absence of age-related diseases like cancer and cardiovascular disease, meaning that there's a link between accelerated aging and activation of the immune system. This is really important for us because these markers are used as predictive markers for aging. Elevated interleukin 6 serum levels are predictive of incident, disability, frailty, walking speed, and even overall mortality risk. And the same thing for interleukin 1b. even all-cause mortality, hypertension, arterial stiffness. And so what happens here is that when the mitochondria aren't doing well, they start promoting their own death. They start promoting the production of pro-inflammatory mediators. And now they're being linked to things like Alzheimer's, atherosclerosis, metabolic syndromes. They're all implicated in this type of inflammaging phenotype. So what do we do about it? Well, mitochondria respond in a lot of various different components and factors, and we'll go through those. But what's even more important is that mitochondria decrease over time. This study was kind of talking about just mitochondrial function in tissue, specifically skeletal muscle. And this is a kind of a double-edged sword, because there's a nearly 50% decrease in the mitochondrial respiratory capacity, aka the electron transport chain, compared to younger subjects. Well, what does that mean? Well, you lose mitochondria over time. Of course, that makes sense. But we're talking about skeletal muscle and what they did these biopsies on. Well, what can you do to increase mitochondrial capacity and or mitochondrial quantity overall? You can exercise, right? We know that high interval training exercise can vastly increase the amount of mitochondria in your cells. Literally any exercise will do that, but we know high interval training will do that as well too. Well, how can you optimize the electron transport chain in your mitochondria? Okay, different types of foods, different types of diets, fasting, cold and warm temperatures can also fluctuate it, but we know that low-level laser can have a significant impact on this too, and we'll talk about that mechanism. We know that autophagy for the mitochondria, mitophagy, decreased markedly in mammalian tissues during normal aging. Well, let's talk about this for a second. Is mitophagy a bad thing? Not necessarily. Mitophagy can be a really good thing for mitochondria that aren't functioning as well as they used to, or they need to get taken out. But it could be a bad thing if we need those mitochondria, and all of a sudden there's some sort of cellular process promoting the loss of mitochondria. Maybe that's us not being physically active as we used to. Maybe it's bad diet. Maybe it's just chronic inflammation, or maybe it's a chronic disease. But we know that increased mitophagy is actually required for longevity in specific in vivo and in vitro models. And what we're talking about is when you actually start losing old cells, these senescent cells that are essentially old cells that stick around, but they haven't been taken out yet. These senescent cells are kind of like the weakest chain in the link. Think of it from like the weakest chain link sense of like your metabolism, the limiting rate in your metabolism, specific aging markers is due to the senescent cell quantity and quality that you have inside your cells. And so if you can get rid of those senescent cells, which is what happens when you promote anti-inflammatory and fasting style diets, you can actually get rid of these old cells to increase your metabolic rate and improve your inflammatory profile. What's interesting with this is that there's like an innate mitochondrial quality control with this. And so your mitochondria are kind of always doing internal housekeeping mechanisms for this. They should be looking at different cells and saying, are you ready to go out? Can you be repaired? And there's some interesting components with this. What happens is when mitochondria aren't doing as well as they used to be, mitochondrial DNA actually gets displaced in the intracellular matrix of the mitochondria. What this triggers is it triggers immune responses. There's an inflammatory response. It changes autophagy and cellular apoptosis. And then what happens over time is you have this chronic inflammatory response going on. Now, your brain and your body can control that in some way, shape, or form, but we have to ask the question, what keeps mitochondria healthy and active? Things that I just mentioned: quality diet, nutrition, exercise. But optimizing things like low-level laser can make an immediate difference for those patients who are maybe mobile, or who maybe can't get up and go work out, or maybe have a poor diet and they're not willing to change it. Are there things that you can do clinically in the office that can have an immediate effect? What I'm going to tell you is yes. And what's really cool with that is it's a non-invasive approach. That's why low-level laser not only works really well, but patients are relatively open to it. Because what these different types of mitochondrial DNA metabolites do when they get out of the cell is they promote chronic inflammation. And I want to go through specifically and just highlight a couple of these because this is going to be a really big thing for us. We're going to specifically talk about tumor necrosis factor alpha or beta. We're going to talk about its impact on tumor necrosis factor alpha and interleukin 6, and then also the production of interleukin 1b. So when we have this NF-kappa beta activation here, what happens is these are all just pro-inflammatory factors and pro-inflammatory pathways that occur as a result of these different types of mitochondrial DNA being expelled from the cell. This is a problem because, like I said, it promotes inflammatory outcomes. It promotes different types of inflammation, immune dysfunction, And at the end of the day, it starts taking away from normal cell function. So why are we looking into low-level laser? Well, low-level laser can vastly improve cellular function and the stability of mitochondria. Low-level laser affects this enzyme called the cytochrome C oxidase. It's in the 4th complex of the electron transport chain, which is really important for the production of ATP. It's a rate-limiting enzyme for the production of ATP within the mitochondria. And what we know is that in vitro experiments, low-level laser can positively affect mitochondrial respiration, increasing levels of ATP, NADH, which is a super important factor for that electron transport chain going from NADH to NAD+. If you've seen any of the aging research, you know that there's a lot of research and a lot of money going into the production of NAD+ precursors, things like RN and NMN, things that are really impactful for promoting the productivity and the production of ATP in the cell. And so what we're finding is that low-level laser can actually have a membrane stabilizing effect due to the increased capacity of sodium-potassium pumps. Your brain and body spends 60% of all the ATP that you produce to literally go towards promoting stability of sodium-potassium pumps. That is a massive amount of energy that's being used to just literally be put towards stabilizing different types of cellular membranes. That's impactful because here's what low-level laser does. All of these billions of photons from low-level laser, and once again, low-level laser is concentrated light. The difference between low-level laser and LED is that they're both photobiomodulation, they're both eliciting photons, but LED and light scatters, and so it's non-collimated. Now, what happens when you have a laser is that your laser is concentrated, and so you get this high concentration of photons going into the cell, and what happens is that this cell membrane, this cytochrome C oxidase enzyme becomes metabolically active and upregulates as a result of accepting these photons. What's beautiful with that is that not only is this a rate-limiting enzyme for the production of ATP, but it's one of the last components of the electron transport chain cycle inside the mitochondria. Some of these other areas, as complex 1, complex 2, and complex 3, one of them, specifically the 3rd complex, is dependent on a thing called ubiquinone, CoQ10. Can anybody in the chat tell me what happens when people take chronic cholesterol inhibitors, statins? Can anybody tell me what happens when you take statin drugs to that ubiquinone molecule? Okay, what happens is that you actually deplete ubiquinone inside the cell. So a lot of these patients who are on chronic statins, so they're lowering their cholesterol for a good reason, or the intention is there, what happens is ubiquinone becomes depleted. Well, what do you think that does to energy production? Why do you think these patients become fatigued? Now they get muscle aches. Now they have secondary and tertiary outcomes and side effects from taking these statins. Well, what happens is you're limiting the cell's capacity to produce ATP. That's a really important molecule. Lo and behold, ubiquinone and CoQ10 is a really important molecule for the production of ATP and mitochondrial respiration. So of course, all the biohackers in the world out there are taking massive amounts of CoQ10 and ubiquinone, which is that there's no difference, it's the same molecule, to try and improve their ability to produce ATP. This is powerful and this is impactful for us. This is relevant for us too, because if you're not producing ATP via ubiquinone, how else can you upregulate the cellular respiration and the electron transport chain? You can utilize low-level laser. So what's beautiful about this mechanism is you can use photons, concentrated photons via the laser to upregulate cytochrome C oxidase. And then what happens is you actually have this unique marriage of oxygen and nitric oxide. So once this cytochrome C oxidase enzyme becomes activated via the photons, what happens is nitric oxide becomes displaced by oxygen. You have a beautiful reaction there, and nitric oxide is displaced. Well, nitric oxide is a local vasodilator. So what it does is it vasodilates the arteries close to the area where you're utilizing the laser, and now you have increased blood flow, increased oxygenation, increased nutrient uptake. And so you actually have this unique marriage of having a couple different mechanisms that are at play as a result of using the laser. And this is really powerful because low-level laser can help with optimizing cellular proliferation, cellular migration, and even taking away different types of things regarding adhesions. It can actually stop uncontrolled cellular apoptosis or uncontrolled cellular death. And this is why low-level laser can be so impactful for your mitochondria and for aging and inflammation as well too, is because if you can upregulate cellular capacity in the mitochondria that happens with inflammation, well, you can slow down or if not eliminate or halt aging. Now, I just I'm done reading David Sinclair's book. I don't know if any of you are familiar with David Sinclair, but he's a PhD researcher out of Harvard. He also has a really cool lab in Australia as well too. And David Sinclair is hot on the trail for finding molecules and novel therapies and approaches to mitigate aging. And his theory is that aging is actually a disease, much like Alzheimer's, Parkinson's, or even anything else you'd want to label as a disease. And so what he means by that is if it's a disease, it can be treated. And so he's looking into the research and investigating all these different ways for us to mitigate this inflammaging process. And this is essentially what he's come down to, is that utilizing different types of molecules, physical exercises, light therapy, understanding thermal and different types of cold and heat capacity and how they manifest via different cellular mechanisms. All of these things can halt aging. Now, of course, he's looking at different types of biopharmaceuticals and things like that, but there's a lot of really good physiology behind this. And this is a really important aspect too that I want to take a point at, is that when you have some sort of traumatic event, and whether it's chronic inflammation or it's a concussion or a brain injury, things that I see in my office relatively commonly, we have changes in mitochondrial function. We have changes in these sodium potassium pumps that we're always really focused on. We have changes in these voltage gated potassium channels that are really important for us. Keep in mind that your brain and body spend nearly 60% of all your energy storage just maintaining the sodium potassium pump. What happens over time is your mitochondria get told, okay, we have stuff going on in the background. Let's start promoting inflammation. Let's start promoting different changes in calcium uptake. How we're utilizing different types of oxidative phosphorylation mechanisms. This becomes a problem for the cell because every single cell in your body is dependent on mitochondria. That's why these mitochondria can have vast effects throughout the brain and body. More importantly, what's going on with trauma and the aging process is that our autonomic nervous system becomes imbalanced. This autonomic nervous system essentially controls every single organ and tissue throughout our brain and body, which is why whether it's with a concussion or whether it's with chronic inflammation or it's with an inflammaging model, we know that these different events can trigger different types of chronic stress responses. It can alter different types of neurotransmitter productions. It can promote inflammation. It can skew immune function. It can cause changes in your hypothalamic pituitary adrenal axis, this big cortisol regulating feedback loop. And so while this becomes an issue, to understand this, we really have to understand the nervous system, because that's the master controller, right? So how many of you have ever had a conversation with a cadaver? Go ahead and raise your hand. It's probably not gonna be many of you, and if there are, then we have a lot to talk about. Okay, cadavers that have all the muscles, all the tissues, all the organs, they have a functioning spine, for lack of a better term. Well, what do they not have? They don't have an intact nervous system. So in order for us to understand function in physiology and aging, we have to understand the nervous system. And the most basic component of the nervous system is understanding the autonomic nervous system. There's two divisions of the autonomic nervous system. We have the sympathetic and we have the parasympathetic. So this sympathetic system, this fight or flight or freeze response that we attribute to the sympathetic nervous system, is in charge of essentially getting us ready for a fight or flight response. So we have increased heart rate, increased myocardial contractility, right? We have vasodilation of the pupils. We have changes that are going to occur that are going to get us ready for that fight or to run away from an object. The exact opposite is the parasympathetic nervous system, kind of the yin to the yang. And this is involved in really essentially decreasing heart rate, decreasing coronary vasoconstriction, right? And this is really associated with vagus nerve function. Anybody who's looking into the inflammaging model will talk to you about utilizing different things like breath work, vagal nerve stimulation, optimizing vagal tone, because what they know and what we know is that chronic sympathetic windup or chronically being stressed has negative and deleterious consequences for our brain and body. It does the same thing as inflammaging does. It promotes inflammation, promotes more pain, it decreases the immune system's function, and over time too, it just wears and tears on our brain and body. So what's really interesting with this space is that when we understand the vagus nerve has a lot of functionality that we really have to think about. It really controls everything from like our throat all the way down to like our midsection of our abdomen. There are some really important relay areas that are involved with vagal nerve inputs and outputs, specifically the nucleus tractus solitarius. I might be getting a little bit ahead of myself on this, but I'm listening to an interesting podcast right now with Andrew Huberman. Andrew Huberman is a Stanford researcher, PhD researcher in neuroscience, but he has an amazing podcast. And the one I'm on right now is where he's talking about depression. And the researcher who is talking about depression is really talking about how they're using deep brain stimulation. They're using transmagnetic stimulation. So transmagnetic stimulation, so it's non-invasive stimulation over an area of the brain, specifically over the dorsolateral prefrontal cortex. Well, what they're finding is that when they actually excite the dorsolateral prefrontal cortex over the left frontal lobe, the left dorsolateral prefrontal cortex, they see symptoms of depression be alleviated. What they also see secondarily is they see changes in heart rate, and they see decreases in heart rate, but they see increases in heart rate variability via vagus nerve input and vagus nerve feedback loops. Kind of interesting. So the theory goes, and this is some of the leading theories with vagal nerve stimulation, is can vagal nerve stimulation actually be used to treat depression? There's a lot of underlying physiology and underlying mechanisms at play that can potentially have a role with that. Now, we don't know for sure, but I can tell you is that there are companies out there looking into this right now, specifically GammaCore, which is a non-invasive vagal nerve stimulator. But here's what I'm going to tell you is that there's some really amazing research that's come out of Erconia showcasing that you can utilize low-level laser over the left side of the neck, over the vagus nerve, like what I'm about to do right now, to be able to help your patients increase their vagal tone and decrease their heart rate. I do it with patients all the time. There are some amazing EEG studies that we've showcased with Calixto Machado out of Cuba that have showcased you can actually do vagal nerve stimulation over the neck and have central changes in the brain and body. So let's get into this vagus nerve a little bit. I want you to understand that there are both inputs and outputs, and that your vagus nerve plays a key role, and is essentially an interface between higher central nervous system circuits and the autonomic control of the brainstem. 80% of the information from the vagus nerve is going into the brain, specifically to this nucleus tractus solitarius. And there's other neural innovators and integrators involved in that as well too, but only 20% goes back out. So it's a 4-to-1 ratio of going in to out. And to be honest with you, we don't fully understand the full innervation or extent of the vagus nerve. But what's really cool about this is that there are really well-established mechanisms, anti-inflammatory properties of the vagus nerve. And we're going to highlight 3 of them. So there's an anti-inflammatory stimulation pathway via this hypothalamic pituitary adrenal axis, which leads to the release of cortisol by the adrenal glands. Well, what do they do? Why do they give you a cortisone shot? Why would they give you a cortisone shot for pain or a chronic inflammatory issue? Because cortisone, aka cortisol, has potent anti-inflammatory properties. Now, it becomes an issue when it's chronically mediated and is always in the bloodstream, but you can have bouts of cortisol be really effective means to help have an anti-inflammatory response. Another mechanism of stimulating the vagus nerve or having vagal nerve stimulation is this thing called the CAP pathway. So it's the cholinergic anti-inflammatory pathway. Essentially what happens is that acetylcholine is released at the synaptic junction, binds onto macrophages via the alpha-7 nicotinic acetylcholine receptors. And what it does is it inhibits the release of tumor necrosis factor alpha from the macrophages. Well, we already talked about this mechanism, right? Tumor necrosis factor alpha is a really important pro-inflammatory mediator that's released by mitochondria that promotes inflammaging. So what we could potentially utilize is vagal nerve stimulation to have an anti-inflammatory effect that can secondarily affect mitochondria via these alpha-7 nicotinic acetylcholine receptors to inhibit the macrophages and mitochondria from releasing tumor necrosis factor alpha. What an interesting mechanism. We could also take a look at the splenic sympathetic anti-inflammatory pathway, where honestly it's relatively the same mechanism. We have norepinephrine now binding to these different lymphocytes, once again binding to alpha-7 nicotinic ACH receptors, inhibiting tumor necrosis factor alpha production. These are really interesting mechanisms. And so what we're finding now is, yes, you need to go after the mitochondria, but could you use the nervous system to modify inflammatory properties and behaviors throughout the brain and body? Absolutely. Now, this is just a really unique depiction of it from a picture standpoint, but I think it serves its purpose because what it shows you is that the brain can have anti-inflammatory effects when stimulated appropriately. Now that's powerful. That's really powerful for us. The vagus nerve specifically is sensitive to peripheral pro-inflammatory cytokines like IL-1, IL-6, and tumor necrosis factor alpha. This is just a massive, massive positive feedback loop. If your mitochondria aren't doing well, they start producing pro-inflammatory mediators like interleukin-6, interleukin-1 beta, tumor necrosis factor alpha, which would secondarily feed forward, inhibiting vagal nerve responses, increasing sympathetic brain activity, right? Causing more stress, causing more anxiety, probably causing depression, things along those lines, which secondarily will have an effect on vagal nerve output, decreasing vagal nerve output, probably promoting more more mitochondrial dysfunction. What's really interesting with this is that in specific septic shock models, they use lipopolysaccharides. They inject these lipopolysaccharides, which are pretty much like endotoxins to the brain and body. They use these lipopolysaccharide models with rodents. And what's interesting is that this lipopolysaccharide inflammatory cascade was actually inhibited by vagal nerve stimulation. So even though you have a lipopolysaccharide molecule promoting inflammation, you can utilize neurological tissue and neurological pathways to suppress different types of inflammatory mechanisms from happening. That's super cool. It's also super powerful too, because you can utilize different types of vagal nerve stimulation therapies in your office. How do you stimulate the vagus nerve? Well, if your vagus nerve is an autonomic regulatory nerve, autonomic regulatory hub, different things like belly breathing, humming and singing, different types of vagal nerve stimulation, which is pictured in the photo that I have here. You can utilize low-level laser therapy. Especially in the literature, 10 hertz is kind of a vagal nerve frequency. It goes between like 5, 10, sometimes 15, 20 as well too, but I just always use a 10 hertz vagal nerve frequency on my EVRL. It's as simple enough as to say, how is this working? And guess what I'm doing? I'm always monitoring heart rate variability and using pulse oxygenation to see if I'm making changes. You can also use different types of suprasegmental influences. So if you want to stimulate the vagus nerve, what else could you do? You could stimulate other vagal nerve, cranial nerve centers. Interesting. You can also promote digestion, salivation, heat and cold exposure. We know that different mechanisms have different properties with vagal tone and autonomic function. What's more interesting with this too is that we know as we age and as we go through different types of traumatic models, altered immune responses manifest. And so we've already kind of covered this with different types of outcomes with mitochondria being suppressed or being altered. So let's take a look from a traumatic brain injury standpoint, or even a concussion standpoint. So we have brain injury, we have a release of immune modulators. What immune modulators do you think those are? Interleukin-6, tumor necrosis factor alpha, interleukin-1 beta, right? The same mechanisms come up over and over again. And so what we see is we see changes in different types of vessels. We see different types of immune responses, essentially suppressing all of these different types of immune cells. And then more importantly too, we see different types of barriers break down. The lungs, the intestines, the blood-brain barrier. The most tightly regulated barrier in your body, the blood-brain barrier, becomes dysfunctional. Now people are prone to more infections. Now people might have different types of outcomes, and this is just a positive feedback cycle. It gets worse and worse over time. We also see changes in your hypothalamic pituitary adrenal axis. Of course we do, right? So we have a traumatic event, the brain is injured. Well, interestingly enough, your hypothalamus sits in your sella turcica in the base of your skull. And so as you have this motion and movement going back and forth, that pituitary gland just sits inside your sella turcica and can be hit, it can be damaged, it can be altered. We know a lot of individuals with brain injuries and concussions specifically have different types of hormonal fluctuations and hormonal suppression that occurs. That becomes an issue for them. So now their circadian rhythms become off. Maybe testosterone levels are off, or maybe estrogen levels increase or decrease based off of that. We know that there are different components at play here. And so what's really important for us to understand is that whether it's with a traumatic model or even the inflammaging model, the immune system is implicated in some way, shape, or form. Where this gets really interesting is that we know that there are central mechanisms neurologically that can control metabolic factors. Well, we already showcased that with vagal nerve stimulation. I love showcasing this study because I think it's a super powerful one. And this study occurred in like 2009 in the Journal of Neurotrauma. What they essentially did is they caused traumatic brain injuries in rats. And what they did after that is they did mid-sagittal or cross-sectional studies of the small intestines of those rats to see if there were any changes that occurred. So I want to just recap really quick. They didn't do anything to the gut specifically. They specifically caused a brain injury, and then they looked at the secondary outcomes that happened via the gut. And here's what they found. The top photo is what a normal GI mucosa should look like. This one right here. It should have thick walls. Think of these as like your castle walls for your immune system, right? So this cell layer for your gut barrier is actually one cell thick. What makes it so unique and so impenetrable is this large mucosal layer that we have here. And this is what gets broken down with things like different types of poor diets, environmental toxins, things like that, bad bacterial profiles. You want to have a thick layer. Well, within 6 hours of a brain injury, you go from looking like this photo to looking like this. A massive disruption of this gut endothelial mucosal layer. More importantly, too, just look at how much area you have in here. Look at how much area you have for absorbing nutrients and making sure that you can have a good filtration system. I mean, which system would you rather have, A or B? It's a no-brainer. And this happened within 6 hours of a brain injury. Okay, most patients don't even realize or recognize within 6 hours of what's happening, and this happens to the gut. So what do you think happens? Well, once the gut barrier is affected, the blood-brain barrier is inevitably going to be affected. And so from this point forward, gut permeability, changes in blood flow, changes in your immune system. 70% of your immune system is found in your gut. Well, 70 to 90% of the serotonin produced in your brain and body and central nervous system is actually found in your gut too. Of the 85 billion neurons that you have in your central nervous system, 100 million neurons are found inside your gut-associated lymphatic tissue in your intestinal tract. I mean, this is a massive hub of information and integration. And so now, maybe you get a hit to the head, or your brain's not doing super well from chronic inflammation, and now you develop autoimmune issues. Maybe now you have food sensitivities, you have allergies. Maybe now you just have this as promotion of this chronic inflammatory response that continues to go over and over and over again. I mean, this is a lot of the stories of these patients that are coming into our offices. So what do we do about them? Well, once the gut barrier becomes affected, we know that the blood-brain barrier is probably not that far behind. And unfortunately, this is actually the model we're using for neurodegeneration. Things like Parkinson's, Alzheimer's, even multiple sclerosis. The latest predictions are that these are actually happening 5, 10, even 15, 20 years in the gut before they actually happen in the brain. What's interesting with this is that these endothelial tight junctions, once again, your blood-brain barrier is the same as your gut-brain barrier with regards to being one cell thick. These astrocyte cells essentially just form your blood-brain barrier and are really tightly regulating it. But these gap junctions, the occludin and zonulin proteins that are responsible for your gut barrier are also responsible for your blood-brain barrier. And once your gut barriers become compromised, now your blood-brain barriers become compromised. This is a vast way to increase aging because look what happens. Now you have all of this inflammatory response going on. You have all of these immune responses going on as well too. You have the promotion of arachidonic acid, interleukin-1b, tumor necrosis factor alpha, and interleukin-6. It's the exact same mechanisms we've been talking about. Of course, you're going to have mitochondrial dysfunction, changes in your ability, your cells to be able to form new synapses, and it's this whole immunoexcitotoxicity model over and over and over again. Not only does it happen via the mitochondria, which your brain is very rich with, but it happens on a cellular level, it happens on a neuronal level, it happens on a physiological level as well too. These are the same mechanisms. And so what's interesting with this is that we know your gut barriers and your brain barriers are major contributors to organ failures after shock and trauma. What's cool with this is that we can utilize vagal nerve stimulation to mitigate issues occurring with traumatic events. And so even in burn models, what they've found is that you can utilize vagal nerve stimulation to improve gut barrier integrity being measured by occludin protein expression. Vagal nerve stimulation, your vagus nerve specifically, has also been implicated, playing an essential role in regulating the inflammatory responses of experimental pancreatitis. Powerful. And this is how simple it can be. It can literally be using the laser over the gut or using the laser over the side of the neck. your vagus nerve is wrapped around your carotid artery because it comes out over your neck. And so the easiest way to find this is to find your pulse. And right over that pulse, you can just throw vagal nerve, you can throw low-level laser over the neck. Now, what I like to do in the office is I have an FX635 in my office, because what's beautiful about that is that I can literally set the laser and I can forget it, and I can maximize my time spent in the clinic with my patients. I can use the laser over their abdomen, or I can use it over their neck to try and stimulate the vagus nerve. And once again, what am I doing? I'm monitoring all of the effects with a pulse ox, with a heart rate variability, using their Apple Watch, their Fitbit, their Oura Ring, whatever kind of objective measure I can get my hands on to make sure we're actually getting the outcomes that we're looking for. More importantly too, what's beautiful about the FX635 and all of these lasers is that I'm an expensive person to duplicate. Doctors are not cheap. And so now what I can do is, now that I have a laser and I get a stand for it, or I have an FX635, I can have a patient on therapy, and now I can go see another patient and I can bill those services simultaneously. So I can bill a low-level laser therapy service while I'm also billing a hands-on therapy, whether it's an adjustment, a physiotherapy, maybe it's another laser modality, I mean, whatever it needs to be. And so you're literally multiplying yourself while also giving these patients evidence-backed therapies to help them optimize vagal tone and mitochondrial function. Now, what's really cool with this is that we know that vagal nerve stimulation can suppress interleukin-6 and tumor necrosis factor alpha responses. Even in a brief 30-minute bout, you can see significant changes in these inflammatory markers. And we also know too that your vagal stimulation can have potent anti-inflammatory effects for preventing lung, gut, and probably even brain barrier integrity with trauma. Now, some of the research is preliminary, but I like to mention this because vagal nerve stimulation is currently being investigated for treating rheumatoid arthritis because of its ability to suppress tumor necrosis factor alpha production. That should be turning everyone's heads upside down. Why? Because vagal nerve stimulation, once again, a neurological mechanism, is being utilized to deploy a chronic inflammatory response. The biohackers out in the world are looking at different types of nutrition and metabolic factors and different types of body-based mechanisms like breathing and cold and warm temperatures, but why aren't they looking at vagal nerve stimulation? They should be, because it affects all the same mechanisms that we've been talking about. Now, it's probably an adjunct or an accessory, more of a yes and conversation, but if it's just as easy as throwing a laser over the side of the neck or the abdomen to get the same effects, doesn't it make sense to do that for your patients? Well, absolutely. Now, what's really well established with this is that we know that low-level laser can reduce pro-inflammatory cytokines like NF-kappa beta and tumor necrosis factor alpha, interleukin-1b, and IL-6, even within 6 hours of an injury. Now, these are really powerful and impactful, but we still have to understand that there's so many mechanisms that go on with this that it's not just a one-size-fits-all answer. What's beautiful and what I love about the laser is that I know that it's non-invasive. I know I can put it essentially anywhere and not hurt anybody. There are no known side effects from these class 2 lasers that Erconia has. Erconia has 21 of the 23 FDA-approved patents for low-level laser. And so what we can do is we can utilize these different mechanisms for the benefits of our patients, but more importantly too, we know that there are a lot of inflammatory processes going on in the background, and it doesn't even matter if you know all of them. All you need to know is that using low-level laser can vastly improve mitochondrial function and promote neurological stability. Those are two very well-established mechanisms that are a part of the inflammaging or the chronic inflammatory mechanisms at play with brain injuries, concussions, and even trauma, right? So what we have to get to is understanding how injury and oxidative stress really play a role, and we've talked a lot about this already. Reactive oxygen species, right? So any sort of genetic predispositions, maybe these are actually genetic SNPs or different types of genetic mutations that have occurred with you. Well, only 5% of diseases can be attributed to genetic or DNA issues. The other 95 are more epigenetic, which means they're more lifestyle based. They're more environmental toxins, nutrition, diet, exercise, sleep, different modifications, different modified lifestyle things that we know can really change your epigenetic makeup and the types of proteins that you actually choose to express from your genome. But the problem with this, once again, is right at the heart of it once again, we have mitochondrial dysfunction. We have different mechanisms dealing with how mitochondria promote homeostasis and immune function, because over time what happens is we see damage in DNA, we see cytotoxic cytokines, interleukin-6, tumor necrosis factor alpha, right, IL-1B, promoting different types of cellular changes, and this is the vastly changing neurodegeneration model that we've been talking about. And so it's no longer just...
Sorry, Dr. Eric, I just got one question.
Yeah, go for it, sorry.
I think it's regarding the timing of the treatment. He's saying, is the 30-minute treatment time correct on the last slide? So it was probably referring to the laser screen.
So I think they're talking about this slide. This slide is specifically for vagal nerve stimulation via like a vagal nerve stimulation device. This is not the dose response that I would use for low level laser. So that's a really good question. This study specifically was vagal nerve stimulation, where they're actually using electrodes. They're either stimulating the vagus nerve over the neck, over the carotid artery, where the vagus nerve wraps around the carotid sheath, or they're stimulating it via transcutaneously via the ear. So that's a really good question. Does that answer the question? Can you just confirm that for me, Jasmina?
I hope it does, yeah.
We'll come back to it. They can ask.
From Neil Chandler,
okay.
Probably referring, what's the name of this guy from Stanford? Probably regarding
Andrew Huberman is the name of the gentleman who's in. So I think it must have been one of his recent episodes. He was talking about, and I haven't finished the full thing yet, but they're talking about depression and mental health and addiction, and how depression specifically, what they see neurologically is decreased activity in the left dorsolateral prefrontal cortex. And what he was utilizing, what he was discussing, was how stimulation electronically, transmagnetically over the left side of the prefrontal cortex, the dorsolateral prefrontal cortex, which is essentially right here, by stimulating that, what they see is increased activity in the nucleus tractus solitarius, which is a large hub and integration center for vagal nerve tone. And what he was mentioning is that when you stimulate the dorsolateral prefrontal cortex on the left side to suppress depression and increase mood, what you also see a decrease in heart rate. And that's because the vagus nerve is becoming activated and stimulating that autonomic response based off of that. That was the whole mechanism based off of that. Now, what they're looking into now and what they're describing is how utilizing different types of vagal nerve stimulation mechanisms could potentially alleviate depression, because it's a two-way street feedback loop between that nucleus tractus solitarius and the dorsolateral prefrontal cortex. Now, there are other neurological mechanisms involved with the emotional centers of the brains, like the anterior cingulate and the insula. But that mechanism and that discussion, that physiologic mechanism is there. There just needs to be a little bit more research. And I know that there are some research studies coming soon to be published that are discussing outcomes with utilizing different types of mechanism to modify vagal nerve stimulation and vagal nerve tone to help with depression. So definitely something to stay tuned to with the research on that.
Okay, perfect. I've got another question from John Oliver.
Yep.
And the question is, does low-level laser therapy work over clothes, or is it best on skin?
It's best on skin, but it does work through clothes. My preference is always to go skin on skin. It's kind of like the analogy of like throwing sand through like a fence, right? So you're going to get some of that sand that goes through the fence, but some of that sand's not going to make it through the fence. And so it's the same thing with those photons. So you want as many photons and as much concentrated photons to go through to the tissue as possible. And that's why skin on skin is always going to be the best choice. You can use laser over different types of clothing, but you know, your results might vary based off of that. Skin on skin is always going to be your best bet.
Okay.
Okay.
Haven't got any other questions, so please do type in your questions as we go along. We haven't got much time left, so Dr. Eric can answer some of your questions.
I'll finish up on my last couple of slides here too. So okay. What's really interesting is we start digging more into just specifically vagal nerve stimulation, the anti-inflammatory outcomes with vagal nerve stimulation. What people are finding is that you can actually see increased measures of autonomic function, quality of life measures, mood, and even sleep. And there's this specific mechanism that I was talking about, is that we can utilize different types of vagal nerve stimulation mechanisms. And it's not just, laser over the neck or like a vagal nerve stimulation over the neck or the ear. It can be changing like things like such as breathing. I mean, breathing mechanisms can be very powerful. Within a 10-15 minute breathing window, you can really change vagal tone vastly just based off the fact of modifying your breathing patterns. And so we know that there's a two-way street with this. And so what's really unique with a lot of these mechanisms is that you can do them non-invasively, because traditionally, if you're an individual who has, let's say, treatment-resistant epilepsy, what they'll do is they'll go in and actually put in a vagal nerve stimulator implant. This is the vagal nerve coming out of the side of the neck. And what they've done is they've opened up the carotid sheath. And what they would essentially do is literally put electrodes around that vagus nerve right there. And they would put almost like a little magnet or battery inside the chest wall, kind of like a pacemaker. And so what happens is when that vagus nerve needs to be stimulated and there's a vent coming, that electrical stimulation would stimulate that vagus nerve and would have the secondary and tertiary effects that we've touched and mentioned on. Well, for most of the doctors in the room, if not all of you, you're probably not putting in vagal nerve stimulation implants anytime soon. The risk for infection is high. It's not a comfortable surgery. It's only really done in the extreme cases of people really needing it. So why not use other mechanisms? Well, here's a really interesting study by Calixto Machado, where he did vagal nerve stimulation utilizing low-level lasers, specifically the EVRL. So he used a red and a violet laser, and take a look at this. This is remarkable. He utilized EEG, QEEG findings. This is baseline, and this is vagal nerve stimulation. This is right after vagal nerve stimulation, or during vagal nerve stimulation, or right after. And this is with the violet low-level laser light. Okay. Well, what's interesting is he also did it with violet and red, and these are the same results. So what you see is you see the baseline. You see vagal nerve stimulation, and then you also see post-baseline vagal nerve stimulation. What happens? Well, what do you think is happening? What does your autonomic nervous system regulate? It regulates every tissue and every organ. So you're going to see changes in blood flow. You'll probably see changes in inflammatory responses, inflammatory profiles. Probably going to see more oxygenation because you're going to have that vasodilatation component, especially if you're utilizing low-level laser. The low-level laser stimulates cytochrome C oxidase. There's an oxidation effect. There's a production of nitric oxide, which will have a vasodilation effect as well. So of course, we're not really surprised by this, but look at how powerful that is. This is a really interesting study that I think all of you should take a look at. Even if you're either on the fence of looking at laser, or you have a laser and you're looking for ways to showcase patients how this works, it's really powerful because this is essentially what you found. They did laser for 10 minutes over the left side of the neck where the carotid artery is exposed, right over where you would be doing a vagal nerve stimulation implant. So what he found was utilizing violet light, and I think there's a little bit of debate on this in Erconia because I think that there's a little confusion for the results on this, but violet light was the best for treating epilepsy. But red and violet combined together was really useful for treatments like depression, neurorehabilitation, dementia, autism, and even coma because of its ability to increase brain capacity coupled with blood flow. That's super powerful. Now, when we're taking a look at this, we have to understand that regardless of the type of provider that you are, we are all receptor-based providers. Whether you're an MD, a DO, a PT, a DC, it doesn't even matter. Whether you're using medication, supplements, therapies, laser, electric stim, light, sound, doesn't even matter. You are having an effect on your patient's brain and body in some way, shape, or form. And we have to understand that. And this is why inflammation and the regulation of inflammation can be so vast, but there are so many opportunities and ways to mitigate inflammation. And these are the highlights. First off, low-level laser therapy, one of the most impactful non-invasive ways to mitigate inflammation in the brain and the body. Vagal nerve stimulation over the head, over the abdomen, the uses for it are endless. But you can also promote prominent anti-inflammatory properties by utilizing intermittent fasting. I can go into some of those mechanisms on a later date, but physical exercise is also one of the most impactful ways to optimize mitochondrial function, decrease inflammation, and promote anti-aging and longevity. Sleep is a powerful mechanism. Heat and cold exposure, mindfulness and stress relieving techniques, right? The hypothalamic pituitary adrenal axis and how cortisol plays a role, the anti-inflammatory effects that occur with that, right? the whole mechanism of utilizing breathing as a way to optimize vagal tone, right? So modifying those different types of the acetylcholine anti-inflammatory pathway mechanisms, really powerful. And then of course nutrition, diet, exercise, all those things. Vitamin D3, K2, important immune modulators. NR and NMN, these NAD plus precursors, quercetin, resveratrol, berberine, all of these things can have an important play there. So what I hope that you've learned, and I hope I've empowered you to do is and understand, is that there are a lot of ways to help your patients. Understanding inflammation and aging is one of the most impactful ways for you to help your patients out structurally, neurologically, and metabolically. And so I hope you're able to take something away. Here's my contact information. I appreciate you spending the time with us tonight. And I know Jasmina has follow-up as well too. So I want to just thank everybody for joining us tonight. And if you have any questions, I'd love to answer them for you.
Yes, Dr. Eric, I've got another question regarding the tumors, as we were talking about, from Neil Chandler again. Effects on tumors, would you use it on someone with cancer?
So that's a really good question. So there hasn't been any research done on cancers and tumors specifically because there's no way to get an IRB for that. One of the contraindications that at Erchonia we promote is not using laser on cancer and tumors because we just don't have the research. Have there been anecdotal reports of people trying it on their patients and seeing results? Yes. But by no means would I say it's a take it to the bank guarantee because you just don't know what type of neoplastic properties you have with a tumor. Now, do I have providers who've used laser on lipomas and had positive results? I have. But Erchonia can't take a stance on that, and so I have to be really careful with answering that question. What I would say is to use your best judgment on that. But what's beautiful about class 2 lasers is we know that they're non-thermal, so they won't heat up tissue, they won't promote free radical formation like level 3 or class 3 or class 4 lasers will. So that's going to be up to the provider, but we always promote as Erchonia to not use low-level laser over tumors or cancers because there's just no research backing that up, and we just don't want to get into a situation where something bad would happen with that. So I have to kind of put a blanket statement on that one.
Okay, thank you. I've got another question from Kirsten, and the question is, how long would you suggest the patient comes in for a treatment, frequency in a weeks, etc.?
Yeah, that's a really good question. I think I need more context as to what kind of condition you're treating. If let's say you have somebody who has a chronic inflammatory issue, I don't see a reason why you wouldn't treat them 2 or 3 times a week. Because, for 10 minutes at a time, get them to sit under the laser, get them to use it wherever you're looking to manage that inflammation. But I hope you're utilizing other tools too, right? So structurally, neurologically, metabolically, there are so many other factors that go into chronic inflammation. But for me, one of the things that I use in my clinic is I'll have patients come into the office and they'll pay for their time of service, but I also rent my laser out to patients. So I'll rent my laser to patients. It's a non-invasive therapy. In the United States specifically, patients can utilize these for at-home use under the supervision of a doctor who's prescribed it to them. And what can happen is patients can get better on their own and they can use it once or twice a day if they would need to. Now, I'm not saying that they would have to, but they have the freedom to use it every single day if they would need to instead of having to come in and see me. So for the most part, I start patients off 2 or 3 times a week. I see most of my patients twice a week. For the really bad ones who are in acute situations, I'll see them 3 times a week. But I think honestly, 10 minutes per session is enough to get the results you're looking for.
Okay, thank you. Well, Lindsay Wayne is asking, if you have someone with general poor health and digestive issues, would you use EVRL on gut, brain, and neck in one session, and how long on each, or just one area at a time?
I would use both because I would want to promote vagal tone over the neck. I'd also want to go over the gut too, just to try and see if there's any other opportunities for vagal tone and or just dampening inflammation in the gut. But I would say most of my sessions last like 10, sometimes 15 minutes. So depending on how long I have, depending on how the patients I'm seeing, depending on the work that I'm doing, I'll put somebody on a laser for like 7.5 minutes for one area, and I'll do 7.5 over another area. But along with that too, you can bet that I'm doing things structurally, neurologically, metabolically. So yes, I'm looking at blood panels. Yes, I'm looking at nutrition and diet. Yes, I'm seeing if that inflammation or inflammatory process is having any neurological outcomes. Are they getting dizzy going from seated to standing? Are they having autonomic outcomes? You know, there are ways to kind of mitigate and go about this. So it's really a yes and conversation. But for the EVRL, I love using the EVRL because it has so many capabilities and properties. And so, yeah, that's my go-to. Absolutely, 100%. I'm going to do as much, you know, therapy as I can with them in the clinic and outside the office to get them back on track. My goal is to get them out of my office living their life. I don't believe healthcare is really having somebody see me for the rest of their life. I'll always be there, but maybe that's a bad business model for me. But you know, I want people to be able to live their life outside of my clinic, and that's my goal, is to get them back on track. And then if they need to come back and see me at some point, great. But if not, I want them living their life. So I find that using these mechanisms is one of the fastest ways to do that.
Okay, I've got another question from Neil
Go for it.
Chandler. Do you use just violet or red and violet on the guy?
For the most part, I use red and violet. Yeah, I'll use violet for skin lesions, open sores, things like that. But for the most part, I'm using red and violet because there's two, you know, they're both laser therapies. They're obviously different frequencies, 405 and 635. But why wouldn't I use them together? That way I get more bang for my buck, more surface area, and I just like using them together at the same time. Most of my protocols are having violet and red, so I just stick with that.
Okay, I think that's all with the questions for tonight.
And if there's any more, shoot me an email, send me a message. Happy to field any of those.
Okay. Well, thank you, Dr. Eric Ries, for hosting this webinar tonight. And for those of you who have attended the webinar, I just had a question even during the webinar regarding the link of the recordings, just to remind everyone that recordings of this webinar will be sent out to all registrants. So if you have any further questions, you can just let us know, send us an email. We'll be more than happy to answer all of that. So yeah, have a great evening, everyone, and thank you for tuning in. Bye-bye.